Today we are going to be going over something that is called check, call, care. We see a victim who could potentially be unconscious. We want to check our environment, make sure it is safe for us to approach her. Then we're going to come down to the victim. We're going to say, can you hear me? We're going to physically touch the victim. Sometimes they can be hearing impaired. We get no response. We know that they are unconscious. We're going to do something that is called a head chin tilt. Check for the carotid artery, check for pulses, and then we're gonna look, listen, and hear for her breathing. So we're gonna come down, we're gonna hear to see if she's breathing, look to see if she's breathing, also feel to see if she's breathing. You're gonna do this for about 10 seconds, which determine that she is unconscious. We're gonna grab somebody's attention, have them call 911, and then perform care, which is again gonna be our CPR. Hey guys, this is my victim that's going to help us with the rescue breathing. My daughter, she's going to laugh during the whole thing. So Mr. Monkey is going to help us out today. And what we're going to be learning today is what is called rescue breathing. And what that is giving rescue breaths to a victim who has a pulse but is not breathing. So to check for pulses, 2 fingers, carotid artery. Don't use your thumb because your thumb has pulses and that's what you're going to be feeling versus theirs. We're going to do a head chin tilt method, and then you're going to have a barrier here. Well, what this barrier does is help protect us against bloodborne pathogens. You're going to put it over their mouth. Make sure you have a good seal when you do this. Head tilt, give 1 breath, and your breath is going to be about 1 second long. You're going to watch that chest rise, and with that, you want to stop when it gets to the top. We don't want to cause any injury to the victim if they're smaller than us. So you're going to do 1 breath every 3 seconds. So let me demonstrate. So 1, 2, 1, 2. And on that 3rd count is when you're going to give that breath. You're going to do continuous rescue breathing for about 1 minute. Thank you. So today we are going to be learning CPR. You still want to do your check, call, care, check your environment, make sure it is safe for you to approach, check the victim, make sure they are unresponsive, and then determine if they're unresponsive, and they are. Have someone call 911, and then you're going to then perform your CPR. So when you perform CPR, you're going to put 2 hands over the chest, and you're going to press down. And you want to go as far as 2 inches on the chest. And you're going to do 30 presses in about 18 seconds. And then when you're done with your 30 presses, then you want to do 2 rescue breaths in between. So you're going to do your head tilt, hold the nose, create a seal around the mouth. You're going to do, and then you're going to continue to do your chest presses like so. Okay, so when you do CPR, you want to do CPR until you are physically exhausted and can no longer perform it anymore, until your environment becomes unsafe for you to perform CPR, and or someone equally skilled or trained is able to switch out with you. That's how long you want to perform it for. Thank you. So we are going to continue CPR until an AED is available. If somebody is with you, then they can go grab an AED. If you are by yourself and an AED is very in close range, then you can go grab one. If it is far, continue to do CPR until EMS comes. So most AEDs have the same setups. You're going to turn it on. You're going to bare the chest. You want and wipe it down. So you want the chest dry. They could be sweating, or they could be wet from a pool or anything like that. So you want to make sure the chest is dry. You're going to shave the upper right and lower left where you're going to put your pads on. So you're going to place them upper right, lower left. You do not want to place your pad in the upper left in case there's a pacemaker or anything that it can interfere with. You're going to steer clear, make sure there is no interference, and then it's going to analyze. And once it's done analyzing, it'll say shock or no shock. So if it says shock, steer clear, it'll give it a shock. Then you're going to check for signs of life. If there are no signs, you're going to continue to do CPR. If there are signs of life, then you are going to roll into the rescue position and stay with that victim until EMS arrives. So our first step when we want to control bleeding is we want to put some gloves on, pretend gloves here, so that we don't get any bloodborne pathogens in contact with us. So if we have an artery that is bleeding, we want to control it. So we'll put our first layer of gauze on in direct pressure for about 5 minutes. If it gets saturated, you can always add layers on to the injury, but still keeping pressure over it. You can always add layers if you need to remove layers. Always remove extra sets that you have, but never the first layer. You want to keep the first layer on so you don't cause any bleeding from what has already been clotted underneath. So next what you are going to do is you're going to get your roller gauze and go over the gauze that you have that's over the wound. You want to be sure not to make it too tight under wherever the wound is at to cut off circulation in that area, but just tight enough to keep the gauze in place. And if you don't need, as you're wrapping it, if you don't need any more pressure, then you can tuck your remaining gauze underneath or above. If you need direct pressure over the wound itself, then you'll take it and kind of come up under, and then what you can do is tighten it down so that, and over any part of the wound that there is. So once you're done wrapping it, you want to check for circulation. Make sure you still have blood flow to the extremities. Anytime if you have to wrap something, then you definitely want to seek medical attention after so that they can get looked at. So once we have the bandage on, if we still can't control the bleeding that way, then we'll do something, we'll place a tourniquet. So I just have this kind of laying around, but they do sell tourniquets commercially. The most important thing is checking your diameter of what you're putting on. If it's something that is too thin, you can cause injury to the blood vessels or anything underneath. But so you want something thick enough that will work. So what you're going to do is you're going to tie it over 2 to 3 inches above the injury like a shoelace, and then pull down pressure here. You'll want something rigid, so I have a makeup brush that I'm just going to use like so, and then you'll take another knot over it and you're going to twist it and keep twisting to create pressure until you can get help. You want to do this to, hopefully this will help stop the bleeding so she doesn't lose a limb, or stop bleeding so she doesn't go into shock, and control it that way. Thank you. Determining if someone is having a stroke, most literature think fast first, then activate 911. We can't tell what type of stroke somebody is having, but we can identify if there is lack of oxygen to the brain. With the skills, think fast. First is face. Ask the victim to smile and see if there is any paralysis to the face. So if they smile, and then one side will be droopy, that can be an indication. A, for arms, ask the victim to move both arms, and if one arm can't move, and then we notice the face paralysis, that is an indicator. Next is speech. We'll want to ask the victim something that they know, so ask them their name. If they get slurred speech, then that's an indicator. And then last but not least is time. And 2 things with time is, when did the symptoms occur, and time to call 911 if we can determine if the victim is indeed having a stroke, and we can let the operators know at that point. Thank you. In this video, we are going to learn how to do a soft splint ankle bandage. So here we have our leg, our ankle injury. You want to check for circulation in the toes. If there's a shoe or anything on there that is supporting it, you don't want to remove that at all. to make a soft splint for an ankle injury, you can use any kind of material. I have leggings here, but you can use anything that is form-fitting, like a blanket, jacket, anything that can form to the leg. So you want to roll it. These are just kind of put both legs together and make a U with it and keep it around her foot. So with these soft splint bandages, is only when EMS is not available and you need to move the victim. So once you have it supported here, you're going to tie over, but you don't want to tie over the injury because that can cause more pain to that. But tie it around the bandage. As you can see, it's on the side of the bandage. And then from there, you just want to check for circulation again in the toes. If you don't have any circulation, it might be too tight, so you want to redo it. But other than that, this will be soft form fitting bandage if you needed to move the victim and EMS was not available. Thank you. So hopefully I can explain this well because I don't have access to make a fire roll. But the second thing, you want to do when you are stranded after finding shelter is to make a fire roll. So you're going to take a piece of cotton. You want to stretch it out thin, and then you can use any kind of material, powdery material, rush, charcoal, wood, ash, even dirt. But the most difficult thing for fire rolls is to find these kind of fibers. But the powder holds in the heat as you give it friction, and it'll ignite the fibers. So what you want to do is roll it tight and roll it away from you until it's really thin. And then you can use 2 rocks. You can use kind of like trees in half, and you can roll it, and you're gonna do friction with pressure. You're gonna do it about 15 to 20 seconds, and you should be able to start seeing some smoke and being able to smell the heat from it. And then once you take it off, you'll be able to see the embers. Once you see those embers, then you can place the fibers into different patches of things to help catch those on fire, and then you're gonna have a fire for yourself and whoever you may be out there with. Thank you.